welcome with us today Dr. David Burt, and he's here this morning. Welcome, Doctor.
Thank you. It's good to be here with you.
Praise God. We're glad you could come and speak to some of these issues. You are certainly trained in this area. Dr. David Burt, he's an immunologist with more than 30 years research experience in universities and vaccine companies in Canada. He has led scientific teams involved in the development of vaccine against various infectious diseases, including influenzas and SARS. He received his PhD in immunology from the University of Birmingham and a BS in biological chemistry from Essex University in UK. He's currently president of DS Burt and R&D Consulting, offering independent consulting advice in biotechnology and vaccine research and development. David is a Christian and an active member of the Apple Creed SDA Church in Markham, Ontario, where he teaches a youth Bible class and leads a boys mentoring program called The Bridge. Dr. David enjoys playing the guitar, soccer, and golf. Welcome, welcome. It's a joy to have you, a man after my own heart. So we're glad that you can be with us today as we could share on this morning. So, how are you enjoying? I know you've been in Canada long enough, so you're certainly the weather does not affect you that much by now, coming from the UK, but we are glad that we have you here in Toronto.
Yeah, it's nice to be here. In fact, the weather here is much better than in the UK, because in the UK it's very damp and cold. Here it's cold, but it's dry. And if you have protective clothing, you're fine.
Well, that's good. I think we just have to make sure we are staying warm in all of this time, and as you know, the winter season come upon us, and as a result, it seems like the COVID pandemic has just gathered speed, especially in the North American context where we are. In Canada, we are still battling this, and we trust that we'll begin to see a downward trend going further. So tell us, Doctor, what is COVID-19?
Okay. Good morning, everyone. It's good to be here with you. COVID-19 is a virus. Well, in fact, COVID-19 is a disease caused by, the proper name is SARS-CoV-2. And the original SARS that came around in 2002 is SARS-CoV-1. But we'll just refer to it as COVID-19 because I think that's the phrase that everybody understands.
Yeah.
So COVID-19 is a coronavirus, and it's a virus that's really been around since the 60s in some form or another. Up until 2002, there were about 4 different types of coronaviruses that just caused a mild respiratory flu-like infection in humans. But in 2002, the SARS coronavirus emerged, and this was the first of the lethal coronaviruses that cause significant and severe disease in humans.
Yeah.
So SARS was the first one in 2002. In 2012, there was another one called MERS, Middle Eastern Respiratory Syndrome virus, which is another coronavirus that came out of the Middle East. And of course, the end of last year, the beginning of this year, we had the third in these lethal coronaviruses called COVID-19.
Yeah. What we realize as you were sharing that there's a progression of it getting, so we had, all of us in Toronto, we can clearly remember SARS, which came on the scene. So is there a progression? It seems like the coronavirus, which is moving the human population, is getting a bit worse with each one that's coming on stream.
Yeah, well, each one has been slightly different. Actually, MERS is the most lethal in terms of the numbers of deaths, but it wasn't transmitted as rapidly as COVID or SARS. So each one has a different type of infectious rate, but they all seem to have come from animal reservoirs. And all of these viruses seem to be endemic. That means that they're part of the natural component of bats. And the COVID or the SARS vaccine, so the SARS virus, came about because the virus was transmitted from bats to a wild cat, and these cats in Guangdong in China were in the markets, these markets that are selling live wild animals, and was transmitted to humans. In fact, even the MERS virus, it originated from a bat that was transmitted to, believe it or not, a camel, and the camel transmitted it to humans in the Middle East.
Wow.
And the COVID, all of the epidemiology and the science suggests that the COVID also came from a bat. We don't really know what the intermediate animal was that transmitted it to humans, but it seems to be, again, when humans and wild animals are in close proximity, there's a chance for a virus to jump from the animal to the human and cause human disease.
You know, growing up as a young boy, one of the things we always were taught: wash your hands. You know, do not touch your face with your hands. These are things, you know, you grow up with, you know, constantly reminding us. And this, in the past year, and even during this one, that's all we're constantly hearing, you know, the proper hygiene of washing hands. And now they have instituted, in terms of the space, that's 6 feet space, and to wear a mask. We were not taught wear a mask, but now it's much more important that you do so. Talk a little about how can we protect ourselves and our families from this virus?
Okay, I think you mentioned some of the ways already, but there are multiple layers of protection that we can introduce to make sure that we don't acquire COVID-19 ourselves, and to make sure we don't transmit it. So there are some personal responsibilities, and these are the responsibilities that we hear from our health authorities. Social distancing, staying at home as much as possible, and depending on the level of the quarantine, make sure that you only leave the house as absolutely necessary. And if you do, make sure you wear masks. You know, there's a lot of debate over masks, and masks have been politicized in some parts of North America. But it's really clear now that masks, if you look at some of the states in the US where it was mandated for people to wear masks, the incidence of COVID-19 and hospitalizations due to that virus is much lower than in areas where masks aren't mandated. And it's the same in Canada as well. So masks, social distancing, proper hygiene, washing of hands, and even the coughing etiquette. You know, often people were just coughing into their hands or into the air, but now you see more people coughing into their sleeves. Avoid touching your face, especially when you're coming from outside. And also making sure you've got some ventilation in your house. I know it's winter, but you can still open the windows now and again. And finally, on top of all of those measures, now we're welcoming the vaccines. And so all of these personal responsibilities, and I would say shared responsibilities, because we're not only trying to prevent ourselves from being infected, but we want to make sure that the community at large is safe. And so all of these measures together create a barrier. None of them are perfect by themselves, because you can wear a mask. You've probably seen people wearing masks where the mask isn't over the nose, it's just over the mouth. So none of these things are perfect, but together they can really reduce the the chances of us being infected.
Yeah, and I think a lot of people who are listening to us this morning probably have experienced this one way or another and may experience this in the days and months ahead. If you should become infected, naturally, the last thing you want to be, hospitalization means that it's getting worse. But so they will ask you to stay at home, isolate yourself. How can you protect your other members of the family? Talk about proper ventilation. What are some of the things that within a house setting, and in some cases, some family does not have the means of even for proper isolation because of home, the home that they're in. So talk a little about what are some of the things that they can do in order to protect themselves and their loved ones.
Well, especially if the accommodation doesn't allow you to isolate in your own room and your own bathroom, because that's ideal.
Yeah.
Because you don't really want to share toiletries, towels, etc. But the safest thing is to wear a mask.
Mm-hmm.
Make sure that you're not sharing things like towels, etc. with other members of the family. And also, it's important, to follow the hand washing. It's probably even more important to make sure you're washing your hands regularly.
Mm-hmm.
And also, it's important to get enough rest.
Yeah.
And to stay hydrated, because this is important to help to flush out the body, to keep the body hydrated. And you need to also make sure that you're cleaning the surfaces that you're using. Mm-hmm. And as far as possible, try and stay away from other people. If you've got symptoms, sleep on the sofa and not in your bed with your wife for 14 days at least.
Yeah.
I know that's hard, but these are things that we have to be careful of. And also, it's important to monitor the symptoms, because although 80% of individuals who are infected don't go on to hospitals or ICUs, but can cope with the infection themselves, you can spread it. And it's also important to monitor, because you don't want to be careless and not monitoring yourself, because if you start, some of the symptoms unique to COVID are there's headaches, there's also a loss of smell, and the most important is difficulty breathing. And if you find yourself in that situation where you have difficulty breathing, it's important to get medical help so that you don't progress further. So really, in the house, you've got to try and double down on the measures that we've all been told that we should be following.
Yeah. Friends, we are having a discussion with Dr. David Burt today on the COVID-19 and vaccine and how we should respond to this. As he shared with some of these things, it is so easy to come in connection with COVID-19. I had that same experience where I just went out and before you know it, the fever started, and before you know it, transmitted. My wife came down with COVID also, but by the grace of God, we were able to pull through and overcome this. So we're encouraging you to always take the precaution and do the things that are necessary to stay healthy in this time. All the symptoms you're talking about, a loss of smell and taste, experience all of these things, but coming back by the grace of God. Now, just before the Christmas, we heard of the coming on stream of the vaccine. It seemed like the entire world were just waiting. That seems like it was going to be the game changer, the lifesaver, the thing that will change things around. So tell us a little about, that's your specialty, the area that you work in. Talk a little about vaccine, because for a lot of people, they have trepidation about taking vaccine. I say to folks, I've taken many vaccines in my life. I travel in remote countries of the world, so I've had to be vaccinated to go to some of those countries. So I've never had a problem in taking vaccines. So talk a little about vaccination and this vaccine for the COVID-19.
Yes, I understand that the trepidation that people have, especially with this particular vaccine, because it's been developed in record time. It is, you know, I've worked in the vaccine area for over 30 years, and I remember that we developed an intranasal influenza vaccine, a vaccine that you could give through the nose.
Okay.
And we start to getting it into humans for the first clinical trial. It took 18 months, and we thought that was a record. We thought that was fantastic, but we know now that with these new technologies, a vaccine has been from beginning to actual approval 9 or 10 months. I mean, that's really amazing.
Yeah.
And that's why a lot of individuals are a bit suspicious. How can a vaccine that's been produced so quickly be accepted and be safe? And you know, normally it might take between 10 or 15 years from start to finish for a conventional vaccine to be developed. So this is really unprecedented in terms of the speed. And I would say that we probably shouldn't be too worried about this, because these vaccines are using technologies that have been in development for 10 to 20 years. They haven't been used commercially. They haven't been used in an approved vaccine up until this time. And these vaccines are the mRNA and the DNA vaccines. Your listeners or viewers have probably heard of the Moderna mRNA vaccine or the Pfizer vaccine. These are mRNA vaccines, and the AstraZeneca vaccine is a DNA vaccine.
Okay.
And normally, the traditional vaccines are essentially vaccines that use inactive parts of a virus, for instance, that are formulated, that are given to our bodies, usually by injection. And our immune system develops antibodies and T cells that can have a memory, and they can reside in our bodies, so that when the real virus or bacteria comes along, expressing that same protein that was in the vaccine, now the virus or bacteria is alive, but the immune system can attack the virus or bacteria and prevent it from infecting our cells. Now, normally, vaccines are either the whole organism or virus that's been crippled or inactivated, so it doesn't cause disease, but it can induce an immune response, or it's a protein from the coat of the virus, for instance, like influenza. It's just the proteins on the surface. But these vaccines, these currently approved vaccines, RNA and DNA vaccines, are essentially a new way to create that protein. And usually the protein that's been targeted is a protein on the surface of the virus called the S protein.
Okay.
The spike protein. The virus has proteins that look like spikes on the surface. And instead of giving this, there are vaccines that have been developed for COVID that actually use the protein and inject the protein into the body. But what we have with these mRNA and DNA vaccines is that instead of giving the protein, we're giving the code or the recipe in form of the RNA or DNA, the genetic code that tells the body how to make the S protein. So instead of getting the S protein, your cells are getting a code or a recipe that tells the cell how to make the S protein. So your cells will make the S protein, release it, and then the immune system will recognize that protein as being foreign and develop an immune response, so that when the real virus comes along, these these antibodies can bind to the coat of the virus and prevent it from infecting cells. So it's really a new way.
Yes.
These DNA molecules, these are the molecules that code for all of our proteins in our chromosomes.
Yeah.
And so we really telling the body, this is a recipe, you make it, and we seem to have effective vaccines that are 95% protective, based on the latest data.
Yeah, and I think humans, we as humans, we love the concept that technology is developing so rapid. I mean, the phone that I had 10 years ago and the phone I have today is different because the technology has moved so closely. But we think if it's going to go into our body, we are much more careful of those things. But as you rightly said, some of these technologies have been in development for a while. We think of even the space age, things they can do today they could not do 2 years ago. The amazing development of in the scientific field that has taken place, and vaccine is just one of those areas in which rapid development has taken place. I had a question, and this is a question I always wanted to ask. Once a vaccine is rolled out, can that vaccine be improved upon, or what is rolled out? That's what is the life of the vaccine is always going to be.
That's a good question. Normally, the approval for a vaccine is so extensive. I mean, for a vaccine to be approved, to be licensed, you have to show obviously safety in first safety in animals. You have to show, you have to do really expensive and extensive tests in animals by independent, not by a company, but by independent labs to show that it's safe. They measure the reactogenicity, they measure blood components. You have to test it at levels multiple times the amount that you give to humans. You also have to make sure that the way you manufacture it is consistent. So you have to make batches that the regulatory authorities will check to make sure that you can make it consistently.
Okay.
Sometimes you have to build new manufacturing facilities just for that particular vaccine. That's it. Those places are inspected annually by the regulatory authorities. And so if you've spent 10 to 15 years developing the vaccine, setting up all the infrastructure, you really don't want to change the formulation or the manufacturing process. Otherwise, you have to re-license the manufacturing facility. You have to retest the vaccine in humans. But there are some vaccines, for instance, influenza, because we know the virus mutates and changes almost every year. And so last year's vaccine might not protect you against this year's virus. So in some cases, like influenza, there has to be some flexibility in enabling a manufacturer to make a slight variant, but the processes have to be identical. And because there's only a short time between knowing what the new strain is versus manufacturing to get out for winter. It's a very rapid process, but because of the history associated with the production and manufacturing and the licensing of the facility, etc., and the safety, the regulatory authorities will allow slight deviations, and you might have to show later on that it hasn't deviated from your manufacturing process. But normally you don't really want to change the process because the licensing process is so extensive and it takes a long time. And you can imagine it's going to, not only for the company, but for individuals who need the vaccine, if you want to change it, then you could be preventing people from getting a vaccine and protecting them from disease. So it's not something that you really want to do, but it can be done in some circumstances.
Wow. Friends, this discussion this morning, we're encouraged to go ahead and share it with someone. Encourage someone to take a look at this. This is area we are just getting the facts, because we are in a time where there's so many misinformation out there. We will encourage you today to get the facts as we go in the rollout of the vaccine, whether it's the Pfizer, the Moderna, that we have AstraZeneca coming on the scene right now. So whatever it is, you want to make sure you get all the information that you can make the right decision for you and your family. Doctor, the survey tells us 25% of Canadians say they will not be getting the vaccine, which, that could be a problem for the community in a whole. So talk about the misinformation wars that is going on. So many misinformation wars. I know you've addressed the whole virus, what it is, and how to protect ourselves. You've addressed vaccine. To talk about some of the misinformation wars. I mean, if you are in any WhatsApp chat group, you have seen those videos who are coming across. So will you share a little about that this morning?
Yes, yeah, and I've been inundated with these videos, and I'm tempted not to look at most of them, but I know that people always ask me, what do I think?
Yeah.
And so I try to look at them, and let me first say that one of the issues that always comes up is that the vaccine has been developed so rapidly it can't be safe.
That's right.
We haven't tested it as thoroughly as we have for other vaccines.
Yeah.
Well, that's not true, because every vaccine that we've had that's been available, that many of us have had in the past, has had to go through the regulatory authorities' criteria for safety.
Yeah.
And most of the reactogenicity, most of the side effects that you see after vaccination occur within 40 days after vaccination. And every vaccine has to pass that threshold. These vaccines that have been approved have had to pass the same threshold. And in fact, some of them have had to go to 60 days. This is the window in which you see the most severe reactogenicity. And every vaccine has side effects.
Yeah.
If you've had a vaccine, sometimes you get a reaction at the site.
Yeah.
Sometimes you might get a little fever or a headache, but these usually disappear within a few days. And this is telling you that your body is actually developing an immune response against whatever's been injected in you.
Yeah.
So this idea that because the development has been so rapid, the vaccines can't be safe, that's not true. They've had to go through they've had to jump the same hurdles as any other vaccine that we've had.
Yeah.
So that's the first thing. It's true that there might be effects that you might not see until millions of people have been vaccinated, and you might see a rare adverse effect that you might not see because you've only tested in 30,000 people. But most of the important reactions take place in the first 40 to 60 days, and these vaccines have passed that threshold. So let's go to some of the conspiracy theories. One of them, and maybe it's not a conspiracy, but it's a bit misleading. If I have a healthy immune system, I won't get COVID. You may have heard that. And people are always talk about using vitamin C and the natural remedies, etc. And these are good. These are good, but they're not going to prevent you from getting COVID or cure COVID. And even the dietetic associations will tell you this. But it's important to be healthy and to have a healthy diet, to exercise, to make sure you have the right nutrients, because these will help your immune system to fight the battle against the virus. But unfortunately, there's no magic bullets to enable you to prevent the infection or to cure the infection. I mean, there are some things like vitamin D and zinc. These are thought to be really important for a healthy immune system.
Yeah.
And so you need to make sure that all of the vitamins and zinc and vitamin D you can get from, obviously, from sunlight. And
Yeah.
I know that in some areas of the world that it's you don't get a lot of that.
That's right.
So you know, it's important to maybe if you want to supplement, or there are certain foods like fortified cereals, fatty fish like salmon. I mean, these have a lot of vitamin D. Zinc you can get from pumpkin and sesame seeds. And yeast. So you need to make sure that your immune system is healthy.
Yeah.
But because you're healthy doesn't mean to say you're going to avoid getting the coronavirus.
Yeah.
Another misnomer, and you know, this is another conspiracy theory that's been going around, that these vaccines are meant to be given to Black people and you know, other minority groups to cull their populations, to reduce their populations. And this came about from some perceived comments from, I think it was Melinda Gates.
Yeah.
An article in Time magazine and the headlines from this article said, Black people and indigenous people should get the vaccine first. And, you know, media, especially social media, likes to be very sensational.
Yeah.
But if you actually go to the article in the Time magazine, what she said was, first she said, the first people that need this vaccine are the 60 million healthcare workers around the world. They deserve to get it before anybody else. Then you have to start to tier from there. And she said in the United States, it's going to be Black people, because we know that because of some of the social conditions that we have to encounter, our people are often more susceptible, and often our people are actually working in some of the more risky areas.
That's right.
Where the virus is in healthcare, in nursing homes. So she went on to say that after healthcare workers, we should be getting the vaccine, and indigenous people. So that was a total misquote, but it's been sent around, and it's gone viral, and a lot of conspiracy theories around that. And we know that you know, history hasn't been kind in terms of science and the impacts. There's been a lot of injustice, but I say that we shouldn't allow the injustices of the past to prevent us from taking advantage of the opportunities in the present.
I like that.
And that's one of the mantras I use.
Yeah.
There's no way in which those things that occurred to our people in the past could be repeated. In fact, because of things like the Tuskegee incident and other things like that, other situations like that, a lot of new rules and standards and practices were placed in the field of clinical testing, like informed consent, to make sure that everybody understands what they're getting and can have the option to be included or not. These laws have been implemented as a result of some of these injustices. So we shouldn't be afraid and think that, you know, these practices are being continued today.
Yeah. It's friends, this is so important of a conversation today. Do not allow the injustices of the past to prevent you from opportunities that may come your way today. With all of the misinformation wars that is going on as to how should we respond, and the reality is, because in our community many live on the margins, it means they don't have access to some of the best healthcare. So as a result, they succumb to disease like the coronavirus. It means also they live in the margins. They have much more. They have much more underlying symptoms and situation in their own lives. Wherever you are, we want you to get the information, so you should know how to protect yourself, but have a good quality of life. How do you protect also your family to ensure that you and your family have a good quality of life? I want to encourage you today, even as we're going to start having that discussion, pastors, wherever you are, this is something that is important for you to be informed, because especially in a community, the influence that we have, let us make sure that the information that we are given, that whatever we are relaying, it is one that is based on facts and the proper information. This is one of my things I always say. If you cannot verify where the source of an information is coming from, do not forward it. Do it, because sometimes we are part of the problem and not part of the solution. The reality, my friend, is COVID is real. It is not a hoax. COVID is real, and we need to do everything that we can to protect ourselves from this. Dr. David, it's such a joy to have you on this Friday. You're going to be with us next Friday to talk a little further about, some of the ethical issues. But even as we wrap up this session this Friday, would you say that, what would you say to the average person listening there and say, you know what, I'm thinking about getting the vaccine, but I'm not sure. What word could you say to them in this moment?
I would say that, and I think you've covered it in a way, there's a lot of misinformation out there.
Mm.
And often this misinformation is presented by individuals who have a certain worldview.
Mm-hmm.
Many of them are anti-vaxxers.
Mm-hmm.
And I'm always surprised at how sort of educated these individuals appear to be. They have lots of letters after their names,
Mm-hmm.
but they're giving false information because they want to convince public who probably haven't got as much scientific awareness and understanding about vaccines as the expert. They want to give the impression that they're giving the real information, and you have to go to where the facts are. You have to go to the legitimate sites like Health Canada, CDC, WHO. I mean, one of the things that one of the biggest misnomers that is going around at the moment is saying, because these are RNA and DNA vaccines, they're going to change our genetic makeup.
Mm-hmm.
This is one of the biggest falsehoods that's going around on the internet at the moment.
Yeah.
And the reality is that these vaccines cannot alter our own DNA.
Mm-hmm.
RNA is very unstable. It cannot stay around in our bodies for very long. That's why the vaccine has to be encapsulated in a lipid. It's like a lipid bubble.
Mm-hmm.
And even the viruses that normally infect us, that have RNA or DNA, they can't incorporate their genetic material into our own. Only certain viruses like HIV, and we know how dangerous that is. And it's dangerous because it has certain enzymes called reverse transcriptases and integrases that can convert the RNA into DNA, and then they can integrate that into our cells.
Yeah.
These vaccines cannot do that. They haven't got those enzymes. And so that's a big misnomer. And I know that a lot of people are concerned about these vaccines, because of that information that's going around. It's not true.
Mm-hmm.
And personally, when the vaccine is available, based on what I can see in terms of the safety and the efficacy, I will take the vaccine.
Yeah. Mm-hmm.
But my goal, when I speak to people like you and your community, and I've done this a number of times, is not to convince people that they should take the vaccine, although I believe they should, but it's to make sure that people are getting the right information.
That's
and
it.
not being hoodwinked by a lot of the social media videos that are going around. And as Christians, I always say that we should not be perpetuating and sending these videos around
That's right.
unless we know and can verify that they're true, as you said, because
Exactly.
the Bible tells us we shouldn't bear false witness.
That's right. That's right.
And when we do this, we're breaking the commandments.
Yes.
We're sending falsehood.
Oh
So
yeah.
let's not do this, and let's not participate
That's right.
in these conspiracies.
Definitely. And that's why I believe getting the information. That's why we're here with you this morning, friends, so that you could have all of the information that you can make an informed decision. For some of you who are part of our 7 Friday audience who are in the healthcare field, many of you are nurses, you're doctors, you are personal support workers, you are going to have to make that decision pretty soon as to what you should do. So you want to get all the information. We are pointing you as to where Health Canada website can give you some information there. You can go to the CDC, also the WHO, and get information, and also listen to people like Dr. David Burt, who is a follower of Jesus Christ, and we have good people out there who can help us to make those right decisions. Thank you so much for joining us this morning on another edition of 7 Friday. We'll encourage you to go ahead and share this video with someone, and we'll invite you to come back next week, Friday, for the second part of our discussion with Dr. David Burt. Thank you so much and have a great Friday. God bless you.